Hello, my name is Dr. Dewan S. Raja. Today I will discuss about tumors of the salivary glands. We have three pairs of major salivary gland like the parotid gland, submandibular glands and the sublingual glands. We have numerous minor salivary glands. Most salivary gland tumors occur in the parotid gland. Major salivary gland like parotid, submandibular, and sublingual tumors are benign tumors. Minor salivary gland tumors are more likely to be malignant. Pleomorphic adenoma, a benign tumor, is the most common salivary gland tumor. Remember that most common salivary gland tumor is the pleomorphic adenoma, and this occurs mostly in the parotid gland. Occurs most frequently among female between the age of 20 and 40 years, and it is a tumor of the parotid gland. Okay, it is a mixed tumor. We will get mixed type of tissue. Epithelial cells are intermingled with myxomatous and cartilaginous stroma. That is, epithelial cells are mingled with that of the mesenchymal cells derivatives. Histologically, pleomorphic adenoma exhibits variation with irregular masses, fusiform epithelial cells, ducts, tubules embedded in a myxoid stroma displaying fibrous, cartilage-like or hyalinized areas. That's why it is called pleomorphic. It has multiple morphology, okay, and this is a benign tumor. It is mostly localized in the parotid gland and present as a painless, movable mass at the angle of the mandible. At the angle of the mandible, here is the location of the parotid gland, here. And it is difficult to remove this tumor completely, and it is likely to recur. Idea is that it is difficult to remove completely and it may recur. Some remaining part may again regrow. It may transform into malignancy and involve the facial nerve. Facial nerve is very important in all type of parotid salivary gland tumor because facial nerve, once it comes out of the cranial cavity through the stylomastoid foramen, it gives 5 branches. It gives 5 branches like the temporal branch, the zygomatic branch, the buccal branch, the mandibular branch, and the cervical branch. Okay, this branching occurs inside the parotid gland. So when the surgeon take out the parotid tumor, surgeon always take care to retain the facial nerve and its branches as much as possible. So management, again, it is surgical management with protection to the facial nerve as far as possible. Okay. Now we are looking pleomorphic adenoma, slowly enlarging neoplasm in the parotid gland of many year duration. Here, this gland is transformed into malignancy. Okay, so sharply circumscribed yellow-white tumor can be surrounded by normal salivary gland tissue. This is carcinoma x pleomorphic adenoma. That is this. This is benign. It is turned into malignancy in another specimen, which requires that recognizable traces of pleomorphic adenoma be found. Regrettably, these cancers when they appear, are among the most aggressive of all salivary malignant neoplasm, producing mortality rates of 30 to 50% in 5 years. Okay, so this benign tumor may be turned into malignant tumor. There is a possibility, and outcome may not be good. So pleomorphic adenoma, before getting to become malignancy, we are seeing in a cut section here, low power view showing well demarcated tumor with adjacent normal salivary gland parenchyma, high power view showing epithelial cell, myoepithelial cell within a chondroid matrix material. This chondroid matrix material. Okay, so this is a low power view showing the well demarcated tumor with adjacent normal salivary gland. This is normal salivary gland, this part. Okay, gland parenchyma will get assigned here. Okay, tumor is here. Here, this is the tumor, and these are the salivary gland here. This is cartilaginous stroma, chondroid matrix. Okay. Warthin tumor, papillary cyst adenoma. This is a benign parotid gland tumor, more common among the males. Heterotropic salivary gland tissue in a lymph node. Cystic spaces lined with double-layered eosinophilic epithelium, all embedded in the lymphoid stroma. So its name is papillary cystadenoma lymphomatosum. So we have salivary gland tissue in a lymph node. That's why its name is like that. Okay. So here, Warthin tumor, papillary cystadenoma, lymphomatosum. Okay, what we are saying. Okay, follicular germinal center beneath the epithelium. Here we got the germinal center. This is lymphoid tissue. Here, this is epithelial tissue. Here epithelial tissue double layer. We are seeing eosinophilic, and this is the lymphoid tissue. We have also germinal center. Okay, cystic spaces separated lobules neoplastic epithelium consisting of double layer of eosinophilic epithelial cell based on a reactive lymphoid stroma. Here, lymphoid stroma. This is double layer epithelial cells. So this is a lymphoid tissue. So its name is papillary cystadenoma lymphomatosum. Okay, here is another one. This is around 15%. Mucoepidermoid carcinoma. These neoplasm are composed of mixture of squamous cell, mucus secreting cell, and mixed cell. Behavior varies from benign to highly malignant. Most common form of primary malignant salivary gland tumor, mostly seen in the parotid gland. Okay, so here is the mucoepidermoid carcinoma growing in nest composed of squamous cell. Okay, we get squamous cell. Okay, composed of squamous cell. Then, as well as clear vacuolated cell containing mucin. Okay, carmine stains in the mucin, reddish pink. This is that. Okay, so this is mucoepidermoid carcinoma. Other salivary gland tumor, like that of adenoid cystic carcinoma, occur in the minor salivary gland. We know that minor salivary gland tumors having tendency to become malignant or cancer. Histologically variable, cuneiform pattern of masses of small dark staining cell arrayed around cystic spaces. May cause pain by perineural infiltration, slow growing malignancy with late metastasis. So it is painful. It may be painful because of perineural infiltration. is slow-growing malignancy with metastasis. Another one is oncocytoma, occur in the parotid gland, large granular eosinophilic epithelial cell, mostly seen in the elderly. So oncocytoma is mostly seen in the elderly. It is benign course. And that's all about the salivary glands. Salivary gland, most common are the pleomorphic, then Warthin tumor, then the cystadenoma, papillary cystadenoma, and salivary gland mostly the parotid gland has the tumor. Most tumors occur in the parotid gland. Okay, and the problem is that parotid gland contains the branches of the facial nerve. So the surgeon, when he take out the tumor, certainly it is the surgical treatment is the treatment of choice. There is no medicinal treatment. It is a tumor, it must be removed, but the surgeon, expert surgeon, always try to protect the facial nerve. Okay, and that's all about the salivary gland tumor. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.